Now we're going to hear from someone else who deserves our deepest gratitude for his immense generosity, Gerald Chan. Gerald Chan, who holds 2 degrees from our school, and his brother Ronnie, they made the transformational gift in 2014 that put the school in a strong financial footing. Gerald's, Ronnie's, and their family members' inspirational gift injected a new energy here at the school that sparked innovative, out-of-the-box thinking. We are so grateful. Gerald was also originally not going to be here because of another commitment this evening. And so he'd recorded in advance a greeting that we will share with you. Thankfully, because of a change in his schedule, we will have Gerald, the electronic version, and Gerald here in person. So if you could please turn your attention to the video once again.
I'm Gerald Chan, a graduate of the School of Public Health. It was 45 years ago that I came to the school. I felt so fortunate to be admitted to the school. As many of my fellow alumni would say, if we had to apply today, we never would get in. But somehow we made it in. The training I had was absolutely fabulous. It was also here in the school that I made the switch from studying the physical sciences to the life science. And it was here that I discovered that research in the life science applied to the population level can do so much to improve human health across the world. In giving the gift that resulted in the naming of the school after my late father, I really wanted to draw the attention to public health. It gives me so much pleasure to know that the school is now in a strong position and that this campaign has been successful, and to know that the school will forever bear the name of my late father, that it is now known as the Harvard T.H. Chan School of Public Health.
Again, many, many thanks to Gerald and to Ronnie and the entire Chan family for their generosity. During the campaign, the school received thousands of gifts, large and small, to support the school's most ambitious goals. Some of these contributions were earmarked for research, some were earmarked for education, others for financial aid and for professorships. Many of these gifts were generously given with no restrictions on their use, meaning that the school has the flexibility to deploy the funds when and where they are most needed. We are deeply grateful for each and every dollar. And now I want to give some details about these wonderful contributions. It's my pleasure to introduce to you Jonathan Lavine, who was co-chair of the campaign along with his wife, Jeannie. We are deeply grateful for their generosity in championing the school throughout the entire campaign and for the wonderful example of their own leadership contributions supporting their passion to advance and improve the impact of our work in the field of humanitarian studies. A very brief profile of Jonathan appears in your program. Jonathan, would you do so kindly join me here at the podium?
Good evening, friends, alumni, faculty, staff, and most importantly, the students at the Harvard Chan School. I'm delighted to be here on this festive occasion as we celebrate the immense generosity of the donors to the school's fundraising campaign in the bright public health future that this generosity has made possible. It's a little bit surprising for me to be here because I thought that the science requirement was going to stand between me and graduating college. But about 7 years ago, Julio Frank and Mike Van Rooyen came to see me, and they opened my eyes to the amazing work done at this institution. And when we were asked to co-chair this with my wife, Jeannie, a dean we were very close to at the business school, Nitin Noria, made sure to not only support it, but encourage us digging in here in the spirit of One Harvard and in the spirit of applying the lessons that we learn over at the business school to be global citizens. So it was an honor for my wife and I to serve as co-chairs of the campaign for the Harvard T.H. Chan School of Public Health. And what a campaign it was. We had extraordinary leadership from 3 deans, Julio and David, and obviously Michelle, and they inspired us all. And Jeannie and I are particularly and deeply gratified by the wonderful response of the whole community, by the outpouring of support for financial aid, for research and education, for professorships made during the 7 years of the campaign, which ended on June 30th. 5 years ago, I stood before a crowd of Harvard Chan supporters, and back then it was just Harvard. We were not yet lucky enough to have the Chan name, and announced the school's goal of $450 million. I was surprised by that a little bit because Julio and I had agreed on 300, and then I was told it was raised to 350, and then 450. And obviously, I am standing here today to share with you how we measured up against that goal. And we absolutely shattered it because of the generosity of Gerald and because of the generosity of everybody in this room and across the globe. We have some really impressive statistics that should make everyone proud. So here goes. I have rounded the numbers a little bit, but not rounded them up. The school received nearly 13,000 gifts during the 7 years of the campaign. These gifts represented 62 countries and all 50 states plus Puerto Rico. Of course, one special gift came from right here in Boston, the unprecedented gift of $350 million from the Morningside Foundation, headed by alumnus Gerald Chan and his brother Ronnie, that resulted in renaming the school after their father. This gift was an absolute game changer for the school. It was a vote of confidence that will resonate for decades, and it immediately had the effect of inspiring so many other donors to dig in and do what they can and to increase their gifts and follow Gerald and his brother's lead. We are profoundly grateful for this thoughtful contribution for the future of the school and the future of public health. Continuing on, we received 7 gifts between $10 million and $25 million, which resulted in a total of $103 million. And another nearly $1.4 million came from 9,400 gifts of under $1,000, which is amazing. Many donors focused on financial aid. We received 4,500 gifts for financial aid, totaling $26 million. Others focused on professorships, and we have been able to create 12 new professorships. And we received $95 million for education from nearly 1,800 gifts. Alumni stepped to the plate as well. More than 8,000 Harvard Chan alumni made gifts during the campaign, and alumni gifts totaled over $387 million. And more than 1,200 alumni from other Harvard schools, including Jeannie and I, contributed $70.5 million. So just in case you had trouble adding all that up in your head, and I know you're science people, so you might have been able to do it, the total raised during the campaign for the Harvard T.H. Chan School of Public Health was nearly $933 million. So I was sort of hoping that there's a $67 million gift in the room so that we could round it up, just in case. Had to do it. You never stop selling. This was obviously way above the campaign goal of $450 million. And we are grateful to each and every person, organization, and institution that contributed to make this exceptional total possible. And I will tell you, the impact that this school has can only be summed up in, a tagline I steal from one of our competitive schools of public health, or one that hopes to compete with us, which is, this is a group of people that saves lives a million at a time. And that's something that should make everybody here, everybody at Harvard, and everybody in this community very, very proud. So let me just end with this. The numbers are one measure of success of the campaign, and by this measure, the school and our community was a winner. But the numbers aren't the only thing that counts. This campaign brought the Harvard Chan community closer together. It united us in common goals and reinforced our shared ideals and values, and it helped point the way to an exciting new future. This is one of the most wonderful results of any successful campaign. It made the institution infinitely stronger and more vibrant. And by this measure, our school is the real champion. So it's even more than that. Because our business is public health, because we are working to improve lives on a wide scale, we measure our success by impact. And this campaign was never just about our school. It was always about looking beyond our walls, about tackling the big public health issues, whether here in Boston or across the world in places like Botswana. 5 years ago, I predicted this campaign would transform the school, and more important, would equip the school for even greater impact over coming decades. I said the world's public health problems demand solutions that cross boundaries, break rules, and go beyond the conventional. And I said that they demand stubborn, unrelenting optimism, because without that optimism, it would be impossible to face down the type of problem that can only be fixed by doing something really, really big. So thanks to this campaign and the generosity of so many, and armed with that stubborn optimism, we are more equipped than ever to look to the future and do big things that need to be done to improve the lives of everyone, everywhere. And during this campaign, early on, I had the pleasure of meeting a member of the Harvard Corporation who, at the very first meeting, took me aside and said, "Jonathan, this is really, really important. Anything I can do to help." And we had a couple of breakfasts, and every time I would bump into him, he would check in. "How's the school public health campaign going?" And that person, wonderfully, has become the 29th president of Harvard. It was Dr. Lawrence Bacow. President Bacow's distinguished career in higher education involves 3 prestigious institutions. From 2001 to 2011, he was president of Tufts University, where he fostered collaboration and advanced the university's commitment to excellence in teaching, research, and public service. Before that, he spent 24 years on the faculty of MIT, following his graduation from MIT with a Bachelor's of Science degree in economics. He then migrated to Harvard for 3 advanced degrees. He holds a JD from Harvard Law School and an MPP and PhD in public policy from the Harvard Kennedy School. Prior to his election to the Harvard presidency in February 2018, he served for several years as a member of the Harvard Corporation, among other positions at the university. You will find more detailed profile in your program, but we are so fortunate President Bacow has agreed to say a few words tonight. So I am thrilled to invite you to please join me in welcoming President Larry Bacow.
Thank you very much, Jonathan, for that very kind and generous introduction. And even more importantly, thank you to Jeannie and you, Jonathan, for your leadership of this campaign and your generous support of the school, and for encouraging others to get involved. Your own words to support and advance humanitarian efforts here and at Harvard is inspiring, and I think we appreciate everything you've done to make this magnificent evening possible. So to Jeannie and to Jonathan, thank you again. So some of you may know I'm a marathoner, and tonight I feel a little bit like Rosie Ruiz. For those of you who don't remember her, Rosie Ruiz is the person who sort of jumped in about a mile before the finish of the marathon and sprinted across the finish line and said, "I won." And I've sort of done that here tonight. One person also deserves a lot of credit, and she's not here. So I just want all of you to join me in thanking my predecessor, Drew Faust, who had the good... Drew had the good judgment to appoint not one, but two magnificent deans of the school, actually three, David, because you stepped into the breach as well, for which we are all grateful. This is a remarkable school in many, many different ways. I came to really appreciate it early in my career as a junior faculty member at MIT, because what Jonathan did not reveal is that I used to teach here in a program which was run by the late Mark Roberts, focusing on environmental health and policy and management. And every summer I taught at the School of Public Health for probably 4 or 5 years. And it was my privilege to do so. So I have long and deep ties to the School of Public Health, which go way, way back. There are lots of different ways to describe the work that goes on at this school. Often we think about it as life-changing work, but I think we need to conceive of different adjectives to describe. Yes, it's life-changing, but life-changing work happens, let's face it, every day across this university. But what happens here is not only life-changing, it is life-improving work. It is life-lengthening work. It is life-saving work. And in fact, if you look at the numbers, they're really quite interesting. Since 1900, thanks in very large effort to the good work that's been done, not just by this school, but by the whole field of public health, life expectancy has more than doubled around the world since 1900. This is really astonishing when we think about it. I think about this in quite personal terms. This was driven home to me shortly after my appointment was announced, when the Harvard Crimson wrote an article which noted that at 66, I was the oldest person ever to assume the presidency of Harvard in 382 years. My wife Adele was sort of stunned by this, and so she consulted a friend of hers who was a geriatrician, and he said, "Oh, not to worry, not to worry. Today, 66 is merely late middle age." So for those of you who've helped some of us assume the position of just late middle age at 66, I want to say a personal thank you. But this statistic of doubling life expectancy in a relatively short period of time is a testament to the human intelligence and inventiveness which we see represented here. It reveals the power of knowledge and the truth and wisdom that power begets to change the world. For me, that's perhaps the single most important message that the university must communicate to the public in the years ahead, a skeptical public, as was noted earlier by Julio in talking about some of the challenges that we face. So much of what we do here at Harvard, and here at the Harvard Chan School in particular, is done for everyone. Everybody benefits when we understand more about the air we breathe, the water we drink, and the food that we eat. Everyone benefits when we keep drunk drivers off the road, when we discourage people from consuming tobacco. Everyone benefits when we uncover the human cost of climate change and shed light on the realities of gun violence. What happens here is not just public health, it is public service, and that is also what the Chan School does. And it's a service with a scope that is ambitious and audacious, service that demonstrates that in the world, the diverse world that we live, this is a world that can be made better, is being made better every day, and every day, not just by the work of this school, by the work of the people who have supported this school, the people who have brought us to this moment in time. And for all of your efforts, we are enormously grateful. It's work that's done in countless different kinds of places, whether or not we're talking about labor and delivery rooms, in developing countries, in classrooms. Wherever you look, you can find the work of the Chan School, helping to transform and to change lives. It's done right here in new centers, which reconceive of how we work collectively. And let me just mention three that I think are worthy, and only three. And I apologize if by mentioning these three, I am leaving out other good things that are happening, but these just struck me as sort of capturing what the school does. Right here at Longwood, one devoted to nutrition, genetic, and metabolic research, another devoted to health and happiness, and we know that happy people live longer. This is true, so it's important that we study this, and also to global cancer prevention. I think the only thing more impressive than this phenomenal list is the countless lives that the generosity of so many will touch. At times like this, I like to think of actually one of my favorite passages from a sacred text, the Talmud. And the Talmud teaches us that to save one life, just one life, is the equivalent of saving the entire universe. And if you think of the work that has been done here, Jonathan said, this school and schools like it save lives 1 million at a time. We have saved and continue to save the universe over and over and over again. I submit to you, there is no higher calling than the work that is done by this school, which transforms lives, transforms society, creates opportunity, and gives meaning to the lives that people live here and everywhere. On behalf of all of those who will benefit and who have benefited, but especially will benefit in the future for your good work, I want to say on behalf of the university and the world, thank you, thank you, thank you.
There is no higher calling. I believe that. I come to work every day feeling that. And that is my mantra. Thank you, President Bacow. That's amazing. The other thing I take away from your talk, many things, but the other one I will say that touches me is the world is our classroom. It has been and it will continue to be, because the solutions that we need to bring out from the classrooms we have here into the world become the classroom. for all of us. So thank you for your statements. Thank you so much, President Bacow. We are so grateful that you are here to celebrate with us, that you took the time to be with us this evening, even though your own exciting celebration is just 2 weeks away from this evening. So thank you for your time. For those of you who don't know, President Bacow assumed his position on July 1st, and he will be officially installed as president of Harvard University on October 5th. Our entire school and all of our friends send their well wishes to both you and to Adele on your presidency. Thank you. And now I want us to move on to something completely different. We have 3 exciting presentations from 3 very different perspectives on 3 very different topics, each looking towards solutions for major public health issues confronting today's societies. We're going to be presenting 3 short lightning talks. These are designed to give you just a taste of the variety of important research that's being undertaken under the public health realm. First up is Sarah Bleich. Sarah's professor of public health policy here at the Harvard Chan School. Following Sarah will be Valerie Beryl, a professor of epidemiology and co-director of the Cancer Epidemiology Unit in the Medical Sciences Division at the University of Oxford. We will also hear from Francesca Dominici. Francesca is the Clarence James Gamble Professor of Biostatistics, Population, and Data Sciences here at the Harvard Chan School. And she is also co-director of the Harvard University-wide Harvard Data Science Initiative. You will find profiles of each of these distinguished professors in your program. Sarah, we'll begin with you.
Good evening. I'm going to talk a little bit about what are some of the evidence-based smart policies which can meaningfully move the needle on obesity policy. And before jumping in to show you some of the evidence that our group has worked on, I just want to level set all of us on the same page. So on this slide, if you direct your attention to the bottom, you'll see 2 maps. A map of the United States in 1995, and on the right is a map of the United States in 2016. What they're showing you is adult obesity prevalence. If you look at the map on the left, that lime green color, or emerald green, represents states that have prevalences of adult obesity up to 20%. If you fast forward 2 decades, the red indicates states with prevalences of adult obesity from 30 to 35%. And then in purple, prevalence of obesity above 35%. By any estimation, the increase of obesity in this country for adults over the past 2 decades has been tremendous. And what we know is that not only does obesity impact everyone, but it does not do so proportionately. So we know that low-income and minority populations are at higher risk for becoming obese. And so the question is, what do we do? And what I want to present to you is some of the evidence around one promising federal strategy and the evidence around one promising local strategy, which is beverage taxes. So starting on the federal side, as you're probably well aware, included in the 2010 Affordable Care Act was a provision which said, if you're a large chain restaurant in the United States, you're required to post calories alongside price. And so here are 4 examples of what you would see today if you went out into restaurants. The law passed in 2010, but was just implemented a few months ago in May of 2018. But in that period, there was a lot of anticipatory behavior by large chain restaurants, and we've been tracking that over time. And so the data that I'm going to present here is from 66 of the largest revenue-generating restaurants in the country. These are your McDonald's, your Chipotle's, your Cheesecake Factories, and these are trends in calories over time. So on the vertical axis, you have average calories, and on the horizontal axis, you have time measured in years. So if you focus your attention first on the green bars, those are items common to the menus. These are the Big Macs at McDonald's, the Whoppers at Burger King, and what you can see is that there's been no change over time, which is exactly what you would expect. Those are core to the business. But the orange bars, those are showing you changes in newly introduced menu calories. And what you can see is that they're going down over time. So if you compare 2012 to 2017, you see that calories went down by 29% or 138. Now, it sounds small, but it does not take a lot of additional daily calories to drive up obesity risk. Just a few hundred daily calories a year or a day over the course of several years will do that. And so if you then also look at, well, what is falling off these menus, this graph, for example, shows, using those same 66 restaurants, that if you compare items that were on these menus in 2012 to what subsequently dropped off, what remained is 70 calories lower. These represent very big public health gains. And if you then compare this to the consumer side, there have been 50 or 60 studies which have asked the question, what is the impact of menu labeling on consumer behavior? And what they overwhelmingly show is maybe a little bit, maybe 20 calories or so in coffee chains or cafeterias, but very little impact. These data suggest that the story of menu labeling is about restaurant reformulation. And that is important because it is not relying on individuals to make individual behavior changes. It's happening at the environmental level. And so if we switch gears then and think about a local policy, one of the most exciting things happening right now in public health and obesity is the example of sugary beverage taxes. So Berkeley, California made history in 2015 by becoming the first city in the United States to have a beverage tax. And we are doing a big evaluation right now, joint with collaborators at the University of Pennsylvania and the Department of Public Health in Pennsylvania to understand what is happening with the Philadelphia beverage tax. So that passed and was implemented on January 1st, 2017. It's a 1.5 cent per ounce tax, and it applies to sugar-sweetened beverages and artificially sweetened beverages. So that means that both a Coke and a Diet Coke would be taxed under this current law. And the way the tax works is it's an excise tax, meaning it's applied to distributors who pass it over to store owners, who pass it over to customers. And so that is the pass-through of the tax. So if you assume 100% pass-through, what this is showing you is the relative increase in price of really common beverages. So if you focus your attention on that 2-liter bottle of Mountain Dew, the increase resulting from the tax is $1. If the base price of that Mountain Dew is also $1, you have doubled the price. And the question is, does that impact consumer behavior? And I'm going to show you some of our preliminary evidence. And to orient you, I'm going to show you data on 700 chain retailers in Philadelphia, which is our intervention city, Baltimore, which is the control city that does not have a tax, and the surrounding counties of Philadelphia. You will see Philadelphia in green, you'll see Baltimore in orange, and you will see the surrounding counties in yellow. And then on the vertical axis, you have the price per ounce. This will answer the question of, is the tax passed through to consumers? And on the horizontal axis, you have time measured in months. So first, I'm going to show you the run-in of what the 2 years looked like before the tax went into effect. The pale colors are non-tax beverages. The bold colors are tax beverages. Green is Philadelphia. That's where you want to focus your attention. The tax happens January 1st, 2017. And here's the change in price per ounce. That represents about a 75% pass-through onto the consumer. So now the question is, okay, does the consumer change their behavior? So let me show you that answer. So now the vertical is volume sales. So how much is being sold at these roughly 700 retailers? On the horizontal, you still have time measured in months. So here's the run-in of the 2 years leading up to the tax. It's bumpy for seasonality. Here's the tax, and here's the change. That's a 57% drop in volume sales. To put that in perspective, Berkeley, which had a 1 cent per ounce tax, dropped by only 10%. This is a huge public health achievement. And we also see that there is really no changes by beverages not covered by the tax. So people are not buying more milk, they're not buying more water, they're just buying less soda. So to try to wrap this all up, when we think about the problem of obesity, it is not one that has a single solution. Rather, it takes policies like these, which pull calories out of the diet a little bit out of the time, which can meaningfully move the needle on obesity. And we care about restaurants and we care about sugary beverages because on a given day, a third of kids and a third of adults are in these restaurants. And sugary beverages, as we well know by work from this school, are a huge source of risk for obesity, diabetes, dental caries, and much more. And the organizing principle around all this work is the thought that I want to leave you with, which is, it is not enough in public health to focus on individuals at a time. We as individuals are very resistant to behavior change. We have all, I'm sure, broken New Year's resolutions. And so everything that we do in this work is focused on how do we encourage the environment and change it to really push people, sometimes harder than others, towards the healthiest solution. So thank you for your attention. Here are some of the funders that have supported this work, including one of the gifts from the campaign.
Thanks, Dean Williams, everyone here. It's been a wonderful occasion, and I'm really delighted to be able to talk to you. And I know one of the frontiers that was in the last challenge, and I think again this time, is rethinking aging. And I took that as a sort of start and thought about talking about dementia, because there's no one in this room, even the students who are not, some are in the room, but some are behind, can't see. Everybody thinks about dementia. If it's not yourself, it's your parents or your grandparents. We all know about it. We all know people who've had dementia. And so it is something that's of great concern. And so I think we all also know that dementia has a very, very long insidious period. It's people don't just get dementia, not have it one day and get it the next day, as does happen with heart attacks or fractures, things that we're used to studying. But because dementia has such a long insidious onset, and people change their behavior as they as it develops, it's really been terribly hard to study dementia. And I think, again, you'd all know, just reading the newspapers, all the media, every day you hear something else that seems to be good or bad for dementia, and they don't really make sense. And so what I want to try and tell you about, and maybe in my 6 minutes now, let you understand a little bit about how to sort out when you read something about dementia, whether you know, whether you think it's real or not. Now, if I can just have my first slide, what's there now. Dementia really does increase, the rates of dementia increase really sharply with age after about 75 or so. And these are just data for women in the UK. It's newly diagnosed different sorts of conditions that are often studied by people. And in the UK, 12% of women who are dementia-free at 85 end up, by the time of 89, a 5-year period, being admitted to hospital with a diagnosis of dementia. That's 1 in 8 people. And if you go beyond up to the 90s, it's bigger still. It's really huge risk. Now I'm going to talk about a study that I'm involved in called the Million Women Study, where we've managed to recruit 20 years ago now, 1 in 4 of all women born in the late 1930s and the 40s. The women were then 56, they're now 76. And we started off, and the part that's shown in red, was we started off being interested in breast cancer, did a lot of work on breast cancer. And as we were doing, because the NHS really has terribly good records, so we can link everyone to all sorts of hospital admissions, while we were busy studying breast cancer and things like that, here was this sort of avalanche of dementia in front of our eyes. There are now 40,000 women in the study who've got dementia. And what I'm going to show you, there's sort of 3 graphs with the same sort of format on the x-axis. We're showing years of follow-up. And in many prospective studies, there's the famous Nurses' Health Study in this country, you ask people questions about different behaviors, or you make measurements, blood measurements and so forth at one point of time, and follow them up to see what happens to them later. And one of the complexities about dementia, which doesn't really affect other conditions so much, is that if people are already on a downward path, they've already changed their behavior in such a way that it confuses the results of research. And what we know, for example, I've used smoking because everyone knows smoking is bad for most things, but if you actually ask people, do you smoke now, and follow them just for a very short time, you end up thinking that actually smoking doesn't affect dementia risk. In fact, early research used to claim that smoking prevented dementia. And the problem is that people have stopped smoking as they're on the downward decline to dementia. And so early results, if you take the first 5 years of follow-up, which is shown in the white square, and the next 5 years, up to 10 years, you get the wrong answer. You get the wrong answer, and there's a sort of technical word for that. It's called reverse causation bias. It's the dementia that makes people stop smoking, and that's why it makes it seem as if smoking isn't so bad. But if you just ignore the first decade of follow-up, you see smoking is very bad. And this is the problem. This is the problem throughout a lot of the research, that you cannot take at face value what someone tells you today, even if they seem to be healthy on all sorts of other scores. If they're on the way down, which people with dementia tend to be for a very long time, you get the wrong answer. And maybe, I think because of the times, I'm going to leave the one on obesity, but the bottom line is obesity turns out, at the beginning it seems like obese people are protected against dementia, but it's because people have been losing weight a long time before they get clinically diagnosed. So obesity is bad too, but there are other things that have been quite misleading, and I'm just going to focus on this for a while. You all know, you've all heard, run, 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 and you won't get dementia. Now, it's true, if you find out who's running or who's active and who's not, in the next 5 to 10 years afterwards, the ones who are not doing much are more likely to get dementia. That's true, but that's because they've already slowed down. If you ignore the first 10 years because of this reverse causation, there's little, if any, effect of dementia. It's really reverse causation, it's bias, it's spurious. And many things that you read in the paper about dementia, you have to ask yourself always, is this real? Is this likely to be true, or is it likely to be a consequence of the dementia? Is it really a cause or the consequence? And many of the things, like someone mentioned statins in some way, there are a whole lot of papers saying people arguing, if you take statins, it prevents dementia, but trials don't show that. And it's because if you're with it enough to take statins, you're not going to get dementia in the next couple of years because you're engaging in things. And that's essentially the main message of my talk. And it's sufficiently obvious that if you read things in the paper, you should know pretty quickly. You just have to ask yourself, is this really a consequence of dementia or a cause of dementia? And much, particularly the read now, tends to be a consequence of dementia. And just showing, if you ignore the first 10 years of follow-up for just in smokers and non-smokers, you get this absolutely straight line that the risk of dementia just goes up with the amount smoked. And smoking really is a much bigger cause of dementia than people had thought before. And so I'll leave this one too, just to finish, rethinking dementia, it's quite simple when you think about it. Of course, in a technical academic sense, you've got to read all the details of the studies to understand what's gone on and what people have done. But as a first approximation, you can think short-term findings are often distorted by changes in behavior that are caused by preclinical dementia. They're not due to dementia. And you have to just ask yourself that simple question: which way do I think things, what makes sense? And you just have to, in a sort of scientific context, you really have to ignore the first decade or so of follow-up to get rid of this, to sort of wash out the people who, although in many ways they seem quite okay, but they're already on the downward path. And so, as the last point, and I haven't gone through just what all our findings are, more and more, if you really look seriously at what the causes of dementia are, they appear to be vascular causes. And I want to say, over there is the professor of epidemiology in the Harvard T.H School, Bert Hoffman, who wrote in The Lancet 30 years ago that it seemed, who was one of the pioneers in studying dementia, that it looked like vascular causes were important causes of dementia. And he's right, and it does really look like that's true. And that does give us ideas about prevention, but it's the field at the moment, I have to say, is really confused, but you're intelligent enough to be able to at least do a first approximation of what you read. Thanks very much.
Well, good evening. I am so honored to be here today to share my vision for the future of public health. As the title of my talk suggests, I believe that the field of data science has never been better positioned to advance public health and to address the challenges of air pollution and climate change. And that is now because we are now able, in ways never before possible, to leverage the convergence of three fundamental assets: public health, data science, and infectious optimism. It was Winston Churchill who said, "A pessimist sees the difficulty in every opportunity, whilst an optimist sees the opportunity in every difficulty." So now I'm going to switch and say something that is going to really, really scare you. I'm going to tell you something really scary. What if I told you that I have a bulletproof evidence of a serious threat to American national security? A terrorist attack in which a jumbo jet will be hijacked and crashed every 12 days. Thousands will continue to die unless we act now. The accuracy of my number is more conclusive than any CIA or FBI intelligence on international domestic terrorist activities. This is the question before us today, but the threat doesn't come from terrorists. The threat comes from air pollution and climate change. The World Health Organization has estimated that in 2012, almost 1 in 8 of global deaths, 7 million total, were due to indoor and outdoor air pollution. The current understanding is that the Environmental Protection Agency is setting safety standards, and if air pollution is below the standard, everyone is safe. But that's not what the scientific evidence is saying. And that's some of my studies and many of my colleagues here at the Chan and at all Harvard University are showing. However, here's the optimism. We are uniquely positioned to address this dire and historically unprecedented public health research challenge. And those include incredible technological advances in data collection from satellite, which I'm going to show you in a moment, sensor, electronic medical record, enormous computational power, and the development of statistical methods that allow data to be analyzed in an unbiased, highly principled way. David Cutler and I, David Cutler is a professor in the Department of Economics here at Harvard and also a professor here at T.H., conducted a study that looked at the health impact of the proposed change to the country environmental policy. And we found that the Trump administration proposed change on environmental regulation could result in the deaths of more than 80,000 American citizens. And when we showed this study to Gina McCarthy, she was very thankful of the study, but she also said, your estimate is very, very, very conservative. So to be maximally effective in protecting the health of the nation and community around the globe, regulatory action and air pollution reduction strategy must be based on solid data and rigorous science. And so my own goal together with so many colleagues around the universities, to advance this new paradigm by creating an open science research data platform, basically assembling a lot of data from several government databases and providing innovative epidemiological evidence on harmful effects of air pollution. Now, I'm going to show you a video and show you the work that me and my colleague, and especially led by my colleague George Wards in the Department of Environmental Health, did in ability to estimate how much pollution we breathe a 1 kilometer to 1 kilometer grid for all the continental United States, and linking this data to electronic medical record for over 60 million Americans a year. Here's the movie. So the red dots are 1 kilometer to 1 kilometer grid, and we, using satellite data and integrating with output from atmospheric chemistry model and traffic data, and using machine learning, we were able to estimate the levels of pollution for each of these grids, and the green dots are the monitoring network by the EPA. So by linking this data with several million, actually we follow 480 million personal record, we were able to publish the largest today study that estimates health effects of fine particulate matter. We found the level below the national ambient air quality standard are actually increasing our mortality risk, and men and black and low-income population had a higher risk. And that's where, by the way, our analysis of 12,000 lives could be saved just by reducing 1 microgram per cubic meter. So my study has been impacting environmental policy in many different ways by educating the public about the health impact of air pollution, reframing the public discourse, and informing decision makers, like, for example, Cory Booker, in a position to power to enable change and protect the health of Americans and communities. I just want to have a slide that shows, these are some of my students and PhD students and postdoctoral fellow, where the importance of data science also comes together with the importance of the science of the data. There is something extremely important in the work done in the Department of Biostatistics, Computer Science, Department of Statistics, Applied Mathematics, which is how do we analyze this huge amount of data with rigor. And that's what leads me to tell you a little bit of the fact that I also serve as a director of the Harvard-wide Data Science Initiative together with David Parks, who is a professor of computer science. And the Data Science Initiative leverages collective breadth across the whole university and together pulls over 200 faculty from all the schools at Harvard. The initiative is currently focused on interdisciplinary research teams that leverage the unique strength, and this includes the evidence-based policies, as an example I gave you, networks and market, data-driven discovery, and personalized health. I'm going to conclude by saying I started my outline with, by outlining my own research and how to tackle a difficult public health challenges. Advancing solutions to these kinds of problems require that we have precise and robust research platform in place, and that includes cross-cutting data science platform, and the capacity to leverage the unique strengths and resources that one Harvard can offer. It also requires that we strategically align the school's strengths with the president's data science initiative. Public health and data science are at an incredible scientific moment, and I believe that we all need to seize this moment in investment in strategic resources and, of course, a sense of infectious optimism. Thank you.
Thank you, Sarah, Valerie, and Francesca. It's really exciting to hear about the very many different threads public health weaves together in service of creating the science that supports our helping to make a healthier world and improving the lives of people everywhere. Thank you for sharing your work with us. As you've seen here at the Harvard Chan School of Public Health, we work on many fronts in service of this calling. Over the past 2 years, we've renewed our focus, identifying several fronts where we believe urgent action is needed and areas where the school can make unparalleled differences. Please turn your attention again to the screens for a snapshot of the key frontiers we will be tackling in the new era of public health that we are embarking on.
Public health is on the verge of the extraordinary, overcoming the toughest challenges to lift lives at unprecedented scale. The next big pandemic is not a matter of if, it's a matter of when. Gun violence claims tens of thousands of lives. Obesity continues to sweep the globe, with devastating health and economic consequences. And climate change threatens the lives and health of communities from Boston to Botswana. These are daunting challenges. But the Harvard T.H. Chan School of Public Health is stepping up to meet them. Why? Because nothing is more important.
Because we believe that all children should grow to fulfill their potential.
No matter where they're born,
no matter their economic circumstances.
Because we know that when we solve together,
we can solve at unprecedented scale.
More than a century of experience tells us
that world-transforming solutions can be unlocked.
So we reject the status quo.
We arm ourselves with new tools and deeper insights.
And we seek solutions with diverse minds.
And the power of partnership.
We look ahead with fierce optimism to public health's next frontiers. Reimagining aging, overcoming violence, cultivating well-being and nutrition, confronting climate change, conquering epidemics. Public health isn't just what we do. It's how and why we do it. We believe that health is a fundamental human right, that better is possible, that science has the power to stop disease, prevent suffering, and help every last person thrive. This is the Harvard T.H. Chan School of Public Health. We advance frontiers that improve the human condition for all.
When we launched our fundraising campaign 5 years ago, we made the decision to let the challenges of our generation define the ambitions of our school. That meant focusing on 4 major threats around the globe. At that time, Those threats that we focused on were old and new pandemics, harmful physical and social environments, poverty and humanitarian crisis, and failing health systems. Challenges like these are so sweeping, so far-reaching, they can feel insurmountable. But 5 years ago, we invited people around the world to join us in this mission, and you responded in ways that we could never have imagined. Thanks to the generosity and vision of our supporters, not to mention the relentless optimism and hard work of our students, faculty, and staff, we're positioned to better than ever before face the challenges of this generation. Today, little by little, day by day, we are laying the groundwork for what we call the next great unlock. The next great unlock being that brilliant idea, or that innovative new policy intervention, or the scientific discovery, or even the smart application and translation of something we've already known a long time ago, but hadn't distributed broadly to the populations that need it. Those can be the unlock that can lift lives and dramatically improve the human condition. As you've seen on the video, we are turning our attention to the 5 frontiers mentioned in the video, and we are calling them the Harvard Chan Frontier, which represent our next target for humanity's needed breakthroughs. And you have seen just a brief overview of what those are. The first one being reimagining how we age. The second one being understanding and working to overcome the impacts of violence. The third being to take on the full interdisciplinary approaches needed to cultivate well-being and nutrition. The fourth frontier being to confront the impacts of climate change. And fifth, and not least, is to continue our work on conquering epidemics. These are the work that we are undertaking as we go forward, thanks to the input from experts, our faculty, our students, fellows, and staff. So we're fighting on many fronts to make sure that humanity is ready when the next big outbreak happens. We're mining mountains of data, as you saw from the presentation that Francesca provided, data to reveal clues about how these diseases spread, where cracking the pathogen's biological code can help us advance treatment and prevention modalities. We're seeking new vaccines for better treatment, and we're helping teams around the world better develop systems for surveillance and response. What we're trying to do collectively as a school, especially in the area of conquering epidemics, would be to stop that patient 0 from leading to patient 6.7 billion. When you take the frontiers together, you see that we've described an extraordinary breadth and depth of the work that we do here at the Harvard Chan School. And you can also see the scope of our ambition. We know that across all of these frontiers, the next big breakthrough in public health are already underway. You've seen that in the presentations, the lightning talks that you heard. In fact, we're beginning to pioneering many of the work that we have done is the beginning of the pioneering work that are done by our faculty here, and you will meet just a few moments as we break for the evening party. To all of you here this evening, I'd like to thank you for joining us. It has been such a pleasure to share the stage with so many of my predecessors, the deans, and to share the stage with President Bacow and with Valerie Beryl, our own faculty members, Francesca Dominici and Sarah Bleich, and of course, our campaign co-chair, Jonathan Lavine. We are truly honored that each of you were able to make it here to take the time and participate in our celebration. I also want to thank our incredible students who've chosen to put their minds and their talents to the cause of public health. I want to thank our alumni who are putting solutions into place every single day. I want to thank our faculty, fellows, and researchers who continue to push the bounds of human knowledge. And a thank you to our staff who help make it all happen. And of course, to our donors who have put their faith in this community and opened the doors of possibility for a better world. Each of you have invested your time, your talent, and your resources in our school and in our collective future. And together, we are improving the lives of millions around the world. Whatever your role you've chosen to play, we are energized and inspired by the trust that you have placed in this community. With your help, we will save and improve lives around the world, just as we have done for the past 105 years. With your help, we will drive discoveries that will change policies, practices, and even behaviors, no matter how hard we know it is to change individual behaviors. As you saw from Sarah's talk, perhaps we go up a level and we change the environment to promote the change that improves the health of populations. And with your help, we'll empower the next generation of public health leaders to follow in the footsteps of so many who have changed the world already to create a better and healthier world for everyone. Thank you for being here this evening, and thank you for your commitment to the cause of public health. I believe, as Larry Bacow said, there is no greater calling. Now, I'd like to direct your attention to the screens one final time for a big thank you from some of our faculty and students. They will represent just a small sample of many of the people in our community whose work has been dramatically enhanced by gifts made during the campaign. We are grateful to all of you. You have made our work easier. You have lightened our hearts. You have reinvigorated our resolve to improve the lives of all people right here in Boston, all the way to Botswana, halfway around the world. Your gifts are so much more than money, as Jonathan shared with you earlier. Your gifts represent your commitment to achieving the future we all envision. Your gifts validate our commitment to working to achieve that future, reassuring us that we are on the right track. And they are your way of showing that we are all in this together. So thank you. After the video, let's really do this one last thing, and that is celebrate together the wonderful Harvard Chan School of Public Health community that we all are. Thank you.
Thanks to your generosity, we have been able to start up a center that's going to help turn the science at the Harvard T.H. Chan School of Public Health into actions that benefit people, not just in the United States, but worldwide.
What we have the opportunity to do now is to use technologies, to use molecular biology, to target preventive strategies to an individual and the individual's need.
One of the greatest challenges we're facing in Tanzania is the high levels of malnutrition. And I'm so grateful for the opportunity to study here, and now I can go back and help improve the health of our population.
What we are able to do with this gift is to develop a pathway for professional development and leadership that will really change the way humanitarian intervention in war and conflict is done.
Thanks to your generosity, I was able to see firsthand that my work is not just about crunching numbers, but it's also about improving people's lives.
The generosity of our donors and the center allows us now to take full advantage of the landscape and make a lasting impact on a great global health problem.
We've been particularly excited about some new funds that have been made available through donors to help us encourage innovative thinking in our students, including supporting entrepreneurial companies with the Harvard Innovation Lab.
My hope is to be able to contribute to the basic human right to health and access to healthcare through my work in academia and policymaking in the Middle East and North Africa region.
What your generosity has allowed us to do is open the first physical footprint of Harvard T.H. Chan School of Public Health in India and help us contribute to the transformation of the health and well-being of lives of 1.3 billion people.
I think the most transformative aspect of this work is going to be to take people away from focusing only on disease and dying and to think about what happens when people function well and what are the factors that need to be in place in order to enable a healthy population that's able to live longer and better lives.
Thank you so much for investing in me. It's a privilege studying here at Harvard Chan, where I've been able to cultivate new skills and develop knowledge to help transform personal notions of social justice and human rights into better care for my patients in Haiti.
Your generosity has allowed us to be true innovators in designing a curriculum that will prepare students for solving public health problems today and across the century. So thank you.
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 谢谢.
Thank you.
Thank you.